What about the COVID situation? How has that affected things? Because I think a lot of offices sort of shut down, and so therefore patients might not have seen doctors. So let's first talk about the patients that are on medications. What happened to them, and how did you continue to manage, the pills or the intravenous's or the injectable versions of these medications? How did you deal with that? Dr. Brown, let's start off with you. How did you deal with those patients in terms of continuing their treatments?
Well, as Dr. Jain said, it's really important that people stay on their medication. And so whether it's renewing prescriptions or whether it's seeing people in the office so that they can get their every 6-month injection, because certain drugs are given as an injectable, I made it a point to be available at least for the patients that need injections. And with COVID, we have babies that need their immunization. It's not just people with osteoporosis. But there's lots of opportunities for people to get their injections and get their medications, either with their own family doctor, with a pharmacist, with getting help from various nurse facilities. So encouraging people to stay on their medication, regardless of what the underlying chronic disease is I think fundamental in medicine. So whether it's hypertension or diabetes or osteoporosis, we do know that people stop taking medication easily, and we need to reinforce how important it is, because what we don't want to see is an increase in fractures based on people becoming a little bit laissez-faire about their medication. COVID doesn't wait. COVID's not waiting for anybody. And so we know that osteoporosis is not a disease that we can just put on hold. We may delay doing a bone density until the hospital was a safer place to be, but that doesn't mean we're delaying the treatment or the decision-making around osteoporosis.
Right. The osteoporosis continues on. It doesn't care about the COVID-19. That's a good
That's
point.
right.
So those are patients that are on therapy, but what about that huge block of patients that might have been screened if they had seen a doctor during this whole COVID period? How are you handling the diagnosis of these things? So Dr. Jain, how is that happening in terms of, now that it's all virtual and things like that, in terms of actually getting people to talk about osteoporosis and getting the diagnosis?
So we're seeing in a lot of studies that are now emanating from European countries where unfortunately COVID hit sooner, and we saw the ramifications already. We saw that during the pandemic, people at risk of osteoporosis, they were not getting the adequate amount of care because everyone was focusing on the COVID pandemic. But as you mentioned, osteoporosis is not going anywhere. So I think it's really important that patients also act as their own advocates, contact their doctors, make sure that their virtual appointments that are booked for the management of osteoporosis or for screening if needed. And the good thing is that, as far as starting a medication is concerned, there's lots of developments where doctors are able to do that. Even through a virtual appointment, we are able to start the medication. There's other avenues, as Dr. Brown pointed out, where patients can get the medication. So I think the whole idea, especially because we know osteoporosis affects the older population, and those are the people who we really need to keep out of the hospital at this point of time. So any fracture, of course, is a bad thing, but during pandemic, we want everyone to be away from the hospital, especially our older population. So all the more reason for us to make sure that we are catching everyone that needs the treatment and starting treatment.
Yeah, and the fractures are still continue on. Dr. Brown, go ahead.
I was just going to say the other thing is older people tend to stay home, tend to be less active. Because of COVID, people have been afraid to be out and be active, and maybe are not eating as well as they did before. So I think we need to make a concerted effort to help people stay on track with that healthy eating, making good choices, doing that weight-bearing exercise, because this is an important disease. And when you look at the population in general, the event that is most likely to happen to a woman after age 50 is a fracture. And that outranks breast cancer, stroke, and heart attack all combined. The most likely next event is a fracture. And we want to prevent that first fracture. We don't want her to have a fracture. So I think we've got to be a little bit aggressive about prevention. about looking at the options and looking at what we can do to improve the overall situation, because COVID's going to be here for a while, and we need to be able to address it and do things in a safe way, but do things in a proper way as well. We can't just postpone a diagnosis and treatment.
I know that both of you have been doing lots of education for doctors in terms of raising the awareness that osteoporosis is important. We want to prevent the fracture so that they don't end up in hospital. But I think through this program, perhaps patients can take an active role and set up an appointment and say, hey, I want to talk about, these following things. That is a preventative strategy. And I think all family doctors would be actually very welcoming of this kind of strategy.